A cataract is a cloudiness of the lens of the eye. So the lens is the natural structure which sits behind the colored part of the eye called iris. And as we grow, this lens becomes cloudy or thickened, and that makes the vision blurry. So cataract is effectively like graying of hair. So it's an age-related change in the lens, which then affects the vision after a certain stage. So the symptoms of cataract are very variable, and it depends on the type of cataract and the work that you do and your hobbies. So many people will not have any symptoms, and because it's a gradual process and they may not notice any change. But sometimes all they may notice is that they have glare while driving at night, or perhaps their glasses are changing very frequently every 6 months or a year. Sometimes people will notice that their vision is foggy or blurry, particularly for, let's say, driving or for reading or even distance vision. So when do you need cataract surgery? That is again a very individual decision, because many people will not have any symptoms, and this decision can be held by consultation with your doctor. So if you are troubled by your sight, which is interfering with your day-to-day life, then it's a time to consider cataract surgery. So you might be noticing blurred vision, you might be noticing glare while driving, or perhaps just that your glasses are changing very frequently. Sometimes your consultant will recommend early cataract surgery. Let's say you have closed angle glaucoma, or your front of the eye is very crowded, or you have diabetes and you need diabetic screening and the view is not very clear. So different types of lenses are there, and lens is actually a plastic lens which sits in the eye after the cataract surgery to replace your natural lens, so that it can still focus the light onto the retina and give you crisp vision. There are three main types of lenses: monofocal lens, which can either focus for distance or middle or near; a multifocal lens, which can focus for distance, middle and near at the same time; or a toric lens, which is used when you have astigmatism, or the shape of your eyeball is not completely like a football, is more like a rugby ball, and that needs to be corrected by the use of the lens. So after cataract surgery, your eye may be covered for overnight, and then you start using some drops the next morning. There are usually two types of drops: a steroid and an antibiotic. Most people can do nowadays most things after the surgery, so there's not like in the past where you had to be very still and you had to not bend down and things like that. So most of the things can be done straight away. The eye may feel a bit gritty, a bit red, a bit watery, but those things settle down over the next 1 or 2 weeks.